Did you know that even one night of poor sleep can affect your memory, your mood, and even your immune system? Sleep isn't a luxury, it's a key part of staying healthy. This is Laura Sant with the University of Idaho Extension. This video is about the importance of sleep and how to improve the quality and quantity of your sleep. This video will help you assess how well you are currently sleeping and teach you some sleep basics. You will also learn strategies to sleep better. Finally, you will learn about common sleep disorders. Here are some sleep statistics. 1/3 of American adults report sleeping less than 7 hours a night. 25% report being diagnosed with a sleep disorder. And 62% of American adults who drive or have a license report that they have driven a car or motor vehicle when feeling drowsy. Sleep is a state of rest for the body and mind. It is characterized by physical and metabolic changes, including a relaxed posture, altered consciousness, decreased movement and responsiveness to stimulation, lower metabolism, and cycles of brainwave activity. Despite all these characteristics, sleep is not a passive event, but an actual process involving changes and renewal of the body and mind. Sleep helps restore and rejuvenate many body functions. Learning and memory. Sleep helps solidify new learning in your brain. It also helps consolidate, organize, and recover memories. Emotional and social behavior. Sleep is necessary for rational, emotional, and social behavior. Those who do not get enough sleep experience more activity in the emotional centers of the brain, which can lead to irrational behavior. Nervous system. Sleep helps the body repair neurons used during the day to keep the nervous system working properly. Immune system. Sleep keeps the body's immune system working properly to provide protection from infection and disease. Growth and development. The body releases growth hormones during sleep. Sleep is important for proper physical and mental development. Sleep deprivation affects you both physically and mentally. It can be characterized by the following: poor decision-making, poor judgment, and increased risk-taking. Poor performance in school, at work, in sports and other physical activities, and while driving. Increased risk of developing health problems, including obesity, diabetes, high blood pressure, and heart disease. Impaired memory, concentration, and the ability to learn. Problems with emotionals, including anxiety and depression, and relationships. Sleep is typically divided into rapid eye movement, or REM sleep, and non-rapid eye movement, or NREM sleep. People experience repeated cycles of NREM and REM sleep during a typical night. Most memorable dreaming occurs during REM sleep. During REM sleep, your brain is active and you dream intensely. Logic, however, is suspended, which is the reason that most dreams do not make sense if you remember them. Your major muscles, like arms and legs, do not move during REM sleep. Because of this, you don't act out your dreams. Other physiological changes that occur during REM sleep include rapid, shallow, and irregular breathing, and increased heart rate and blood pressure. REM sleep is important because it helps us process emotions, retain and solidify memories, relieve stress, and transfer information from short to long-term memory. NREM sleep is divided into 3 stages. Stage 1, drowsy sleep. This is the dozing off period, which typically lasts 1 to 5 minutes. The body hasn't fully relaxed yet, and it's easy to wake up during this time. The eyes move slowly under the eyelids and muscle activity slows down. Stage 2 is light sleep. This is when the body enters a more relaxed state, temperature drops, and breathing and heart rate slow. Brain activity generally slows as well, although there are short bursts of activity called sleep spindles. These are believed to help stabilize memory. Stage 3 is deep sleep. In this stage, your body relaxes even more. Some experts believe this stage is critical for restorative sleep. The body repairs itself and regenerates tissue. Your physical energy is restored. Bones and muscles are built and immune function increase. Deep sleep typically occurs in the first half of the night and lasts for 20 to 40 minutes in each sleep stage cycle. This table gives general recommendations for how much sleep is needed for people in different age groups. These are based on averages and vary by individual. The amount of sleep that you need depends on your genetic makeup, the amount of exercise you get, your daily activities, and the quality of your sleep. The key to knowing whether you are getting enough sleep is whether you wake up refreshed and don't feel sleepy throughout the day. The National Sleep Foundation has an assessment tool. How's your sleep? We will go over it in this video, and there will be a link to the actual assessment in the video description below. To take the assessment, you simply acknowledge if you ever experience any of the following. Loud snoring. You or others have observed that you stop breathing or gasp for breath during sleep. Feeling sleepy or dozing off while watching TV, reading, driving, or engaging in daily activities. Having difficulty sleeping 3 nights a week or more. For example, trouble falling asleep, waking frequently during the night, or waking too early and cannot get back to sleep. Feeling unpleasant, tingling, creepy feelings, or nervousness and the urge to move in your legs when trying to sleep. Interruptions in your sleep, for example, nighttime heartburn, bad dreams, pain, discomfort, noise, sleep difficulties of family members, light or temperature. If one or more of the above statements describe symptoms that you are experiencing, you should make an appointment to discuss this with a healthcare professional. While there are many possible reasons for having sleep problems, one may be poor sleep habits. Getting a better night's sleep may be as easy as making some simple lifestyle changes. The tips for sleeping better include improving daytime habits, creating a better sleep environment, following a pre-sleep ritual, and getting back to sleep faster. Here are some tips to improve your daytime habits. Surround yourself with bright light after awakening. Bright light helps regulate your body's natural biological clock. It can help you wake up more fully and be ready to face the day. Spend more time outside during daylight. Take your work breaks outside in the sunlight. Exercise outside, or walk your dog during the day instead of night. Let as much natural light into your home or workspace as possible. Keep curtains and blinds open during the day and try to move your desk closer to the window. If necessary, use a light therapy box. This simulates sunshine and can be especially useful during short winter days. Exercise during the day. People who exercise regularly fall asleep faster at night, sleep better, and feel less sleepy during the day. Regular exercise also improves the symptoms of insomnia and sleep apnea and increases the amount of time you spend in the deep restorative stages of sleep. The more vigorously you exercise, the more powerful the sleep benefits. But even light exercise, such as walking for 10 minutes a day, improves sleep quality. It can take several months of regular activity before you experience the full sleep-promoting effects. So be patient and focus on building an exercise habit that sticks. Regular exercise can improve your sleep. However, timing is the key. Because exercise speeds up your metabolism, elevates body temperature, and stimulates hormones like cortisol, it is best to avoid exercise in the evening or night. Try to finish moderate to vigorous workouts at least 3 hours before bedtime. If you're still experiencing sleep difficulties, move your workouts even earlier. Relaxing, low-impact exercises such as yoga or gentle stretching in the evening can help promote sleep. Avoid napping. Napping can throw off your body's clock, making it difficult to fall asleep and stay asleep at night. If you need to nap, try to limit it to 30 minutes or less. Be smart about what you eat and drink. Your daytime eating habits play a role in how well you sleep, especially in the hours before bedtime. Focus on a heart-healthy diet. If it's your overall eating patterns rather than a specific food that can make the biggest difference to your quality of sleep, as well as your overall health. Eating a Mediterranean-type diet rich in vegetables, fruits, lean meats, and healthy fats. And limit amounts of processed foods and red meat may help you to fall asleep faster and stay asleep for longer. Cut back on sugary foods and refined carbohydrates. Eating lots of sugar and refined carbohydrates such as white bread, white rice, and pasta during the day can trigger wakefulness at night and pull you out of a deep restorative stages of sleep. Limit caffeine and nicotine. You might be surprised to know that caffeine can cause sleep problems up to 10 to 12 hours after drinking it. Similarly, smoking is another stimulant that can disrupt your sleep, especially if you smoke close to bedtime. Avoid big meals at night. Try to make dinner time earlier in the evening and avoid heavy, rich foods within 2 hours of bed. Spicy or acidic foods can cause stomach trouble and heartburn. Avoid alcohol before bed. While a nightcap might help you relax, it interferes with your sleep cycle once you're out. Avoid drinking too many liquids in the evening. Drinking lots of fluids may result in frequent bathroom trips during the night. Nighttime snacks may help you sleep. For some people, a light snack before bed can promote sleep. For others, eating before bed leads to indigestion and makes sleeping more difficult. Creating a better sleep environment is next. Here are some tips. Have a comfortable bed. Test different types of mattresses, mattress toppers, and/or pillows to find the ones that are most comfortable for you. If you are frequently disturbed by a restless bedmate, try switching to a larger bed. Save the bed for sleeping and sex. Reading, watching television, paying bills, working on the computer, or scrolling social media while in your bed can hurt your sleep. When you do these other activities, your body associates these activities with the bed. For this reason, it is recommended that the bed is safe for sleeping and intimacy. Keep the bedroom peaceful. Quiet. To keep your bedroom quieter, close doors and windows. Use a fan or background noise, such as pink noise, to help block out outside noises. Try earplugs if needed. Dark. Block out light sources by closing doors and windows, turning around your clock, blocking other sources of light, or using a sleep mask. Comfortable. Make sure that your bedroom is well ventilated and at a consistent temperature. A temperature that is too low or high can disrupt sleep. Most people sleep best at a temperature around 65 degrees Fahrenheit. Without pets. Consider keeping pets off your bed and out of your bedroom. They can disrupt your sleep by aggravating allergies, making movements or sounds, and affecting temperature. Follow a pre-sleep ritual. Keep a regular sleep schedule. This includes going to bed and waking up at about the same times every day, even on weekends and holidays. A regular sleep schedule helps your body to expect sleep at the same time every day. Even if you have a poor night's sleep, it is best to still stick to your sleep schedule so you don't make it harder to have a good night rest the next night. Embrace bedtime rituals. Bedtime rituals tell your body that it's time to slow down and prepare for sleep. Like a regular sleep schedule, your body will do best if you establish a certain bedtime routine that includes rituals. Rituals may include listening to soft music, taking a warm bath, reading for pleasure, meditating, and doing relaxation or breathing exercises. Wind down and clear your head to fall asleep. Do you often find yourself unable to get to sleep or regularly waking up night after night? Residual stress, worry, and anger from your day can make it very difficult to sleep well. Taking steps to manage your overall stress levels and curb worry can make it easier to unwind at night. Problems clearing your head at night can also stem from your daytime habits. The more overstimulated your brain becomes during the day, the harder it can be to slow down and unwind at night. Maybe like many of us, you're constantly interrupting tasks during the day to check your phone, email, or social media. Then when it comes to getting to sleep at night, your brain is so accustomed to seeking fresh stimulation, it becomes difficult to unwind. Help yourself by setting aside specific times during the day for checking your phone and social media, and as much as possible, try to focus on one task at a time. You'll be better able to calm your mind at night. Write down worries. Worry and anxiety excite the nervous system and make it harder for you to sleep. Write down your worries and possible solutions before you go to bed to avoid thinking about them all night. A journal or task list can aid you in letting go of your concerns until the next day. Use a deep breathing exercise, body scan, or meditation to help you fall asleep. It's normal to wake briefly during the night, but if you're having trouble falling back to sleep, these tips may help. Stay out of your head. Hard as it may be, try not to stress over your inability to fall asleep again, because that stress only encourages your body to stay awake. To stay out of your head, focus on the feelings in your body or practice breathing exercises. Taking a breath in, then breathing out slowly while saying or thinking the word ah. Take another breath and repeat. Make relaxation your goal, not sleep. If you find it hard to fall back to sleep, try a relaxation technique such as visualization, progressive muscle relaxation, or meditation, which can be done without even getting out of bed. Even though it's not a replacement for sleep, relaxation can still help rejuvenate your body. Do a quiet, non-stimulating activity. If you've been awake for more than 15 minutes, get out of bed and do a quiet, non-stimulating activity such as reading a book. Keep the lights dim and avoid screens so as not to cue your body that it's time to wake up. Postpone worrying and brainstorming. If you wake during the night feeling anxious about something, make a brief note of it on paper and postpone worrying about it until the next day when it will be easier to resolve. Similarly, if a great idea is keeping you awake, make a note of it on paper and fall back to sleep knowing you'll be much more productive after a good night's rest. Keeping a sleep diary can be a great way to identify what's preventing you from sleeping well. Here are things to include in your sleep diary. Use a fitness tracker to help you also with your sleep diary. Bedtime and waking time. Total sleep hours and time spent awake during the night. Include when and what you did while you were awake. Sleep quality. Caffeine, alcohol, nicotine, drugs, and medication. Include how much and when you consume caffeine, alcohol, nicotine, or drugs during the day. Also, jot down any medications you took. Include when you took it and how much you took. Food and drink. Include what, when, and how much you ate. Feelings. Write down your feelings and emotions like happiness, sadness, stress, or anxiety. Another sleep assessment that you can use is the Epworth Sleepiness Scale. How sleepy are you? We will go over it in this video, and there will be a link to the actual assessment in the video description below. To take this sleep assessment, you rate how likely you are to nod off or fall asleep in the following situations, in contrast to feeling just tired. This refers to your usual way of life in recent times. Even if you haven't done some of the things recently, try to work out how they would have affected you. It is best that you answer each question as best you can. Use the following scale to choose the most appropriate number for each situation. The scale is 0 points for never, 1 point for slight chance, 2 points for moderate chance, and 3 points for high chance. Sitting and reading. Watching TV. Sitting inactive in a public place like a meeting, theater, or dinner event. As a passenger in a car for an hour or more without stopping for a break. Lying down to rest. Sitting and talking to someone. Sitting quietly after a meal without alcohol. In a car while stopped for a few minutes in traffic or at a light. Add up your points to get your total score. A score of 10 or greater raises concern. You may need to get more sleep, improve your sleep practices, or seek medical attention to determine why you are so sleepy. Some behaviors during the day are signs of sleep deprivation, including irritability, sleepiness, slow reaction time, inability to concentrate, and depression. Additionally, think back to the How Sleepy Are You assessment. If you are experiencing one or more sleep deprivation signs during the day, you may not be getting a restful night's sleep, or you may have a sleep disorder. While there are many types of sleep disorders, some of the more common ones are insomnia, sleep apnea, restless legs syndrome, and narcolepsy. We will be discussing some common symptoms of each of these sleep disorders. If you feel you may have one of these sleep disorders, consult your healthcare provider. Insomnia is the significant lack of high-quality sleep. It can be short or long-term. Possible causes may include stress, change in time zone or sleep schedule, poor sleep habits, or an underlying medical or psychiatric condition. Symptoms include difficulty falling asleep even though tired. Some people may use harmful sleep aids such as habit-forming pills or alcohol to fall asleep. Awakening during the night or too early and not being able to get back to sleep. Feeling unrefreshed or lethargic when waking up in the morning, and daytime drowsiness, fatigue, or irritability. Sleep apnea is a very serious, potentially life-threatening disorder in which people stop breathing repeatedly while they sleep. Some of the symptoms of sleep apnea include loud snoring, choking or gasping during sleep to get air into the lungs, restless tossing and turning during sleep, waking up suddenly to restart breathing or waking up in a sweat during the night, feeling unrefreshed or having a headache, sore throat, or dry mouth in the morning after waking up, and daytime sleepiness, including falling asleep at inappropriate times, like while driving or at work. Restless legs syndrome, or RLS, is a sensation in the legs that usually causes people to move their legs to deal with that sensation. This delays the onset of sleep. Some of the symptoms of RLS include the irresistible urge to move legs due to uncomfortable tingling or creeping sensations, and small jerky movements of the toes, feet, and legs as you are trying to fall asleep. Narcolepsy is a chronic neurological disorder affecting the part of brain that regulates sleep. Some of the symptoms of narcolepsy include intermittent, uncontrollable episodes of falling asleep during the day, excessive daytime sleepiness, and sudden, short-lived loss of muscle control during emotional situations. If you suspect that you may have a sleep disorder, here are a few steps that will help with getting diagnosed. Keep a sleep diary. Begin by recording sleep habits and daily routine as mentioned earlier. Follow the tips for sleeping better. Most common sleep problems can be solved by making lifestyle changes and improving your sleep habits. Many tips for improving sleep habits were discussed earlier. See a healthcare provider or sleep specialist. If you make lifestyle changes and improve your sleep habits, but your sleep does not improve, it is time to see a doctor or sleep specialist. Medical professionals diagnose sleep disorders based on a number of factors, including symptoms, age, gender, psychological and medical history, sleep diary, sleep questionnaires, and sleep tests.